land that Evan and Geisinger's joint venture will acquire, and we will expand parking and actually have even growth more in the future for parking. So we believe the facility needed more parking. So why do this? What I would say to you is that healthcare providers always talk about the fact that we always treat you when you're ill, and we have worked in our own ways to try to take care of people when they're well and keep them that way. And this is really making an investment in the community, saying, you know, in order to really have a healthy community, we need to invest in the community in this way to ensure the continued health of the community. And Geisinger, through their research arm and through their health plan, have the ability to really study, are you really improving the health of a community by focusing on these initiatives? And I guess I would tell you that my belief system is that in a community the size of Lewisburg, you know, whether you want to call it the Pareto principle or whatever, you know, the 80-20 rule, but when it comes to donors, you know, 80% of the monies come from a few donors. And there's all kinds of nonprofits out there, you know, doing really good work, but they're all recruiting and soliciting the same dollars that everybody else is. And even in Geisinger are some of those places where dollars are solicited. And we felt like this is where we can make an investment. This is where we can really begin to bring people together. And our objective is to continue to work with everybody in the region, because your health just isn't your physical health. It's your mental health. It's your social health, it's everything. And from youth all the way through seniors, there's just so many opportunities here. And I think that if the community really rallies together and sort of like we all did, get out of your own way a little bit and figure out how we can work together, we think we can do great things in this facility. And as health systems, we have the ability to say to diabetics, I'm sending you to a cooking class, you know. So here's your referral to the cooking class. You know, you're a 25-year-old woman, you're a diabetic, you're maybe 50 pounds overweight, and you're starting to think about having a child. If I can get this person to drop 25 pounds and learn to cook differently, they stand a better opportunity of not having a high-risk pregnancy or a problem. And those are the kind of things that we can see opportunities with to steer patients. And when you talk to doctors, they talk about this all the time. They need a place. You know, they come in and an orthopedic surgeon talks to you about your knee. They don't really have the time to talk to you about the fact you need to drop 50 pounds. And this is an opportunity for them to be able to steer you to people who can help you with that. So we just see endless amounts of opportunity there. I wanted to talk to you about Prime. Somebody mentioned they saw it in the newspaper today, but this is our project that's going on. I call it beachfront property. It sits right there on 15, so everybody sees it. There's even been some fender benders around Prime. People are looking and not paying attention, and fortunately nothing horrid, but some damage. But this is, if you were at the first red light there as you turn into the hospital by Plaza 15, this is the southeast elevation, but what Prime is it's moving us to majority of our rooms being private. We're a 132-bed hospital. We're not going to get any bigger, but most of our rooms are, you know, shared. 2 people to a room, 2 people share a bathroom. Sometimes, and too frequently, 4 people are sharing bathrooms. It's really not the customer expectation from a satisfaction standpoint, from a privacy standpoint, just not what people want. And we're oftentimes full at about 60% capacity because, you know, if Becky and I have a respiratory infection and we're sharing a room and they find out we have different infections, she gets isolated in a room and a bed comes offline, I get isolated, a bed comes off, and so what would have been in 4 slots is really now 2 beds. And so we have just tons of issues. And if I want to attract and retain the best staff and the best physicians, I need to have better spaces for them to work in. And the bottom line is, you know, this is an aging population in the region in which we live, and we've seen our bed need go up. And so, and the community has cherished this hospital and there's a lot of money in the bank, and it seemed like the right thing to do for the community to have better inpatient rooms. So we are building a first floor here that'll have a conference center. It'll have medical infusion and pre-admission care, as well as some other guest services. Second floor will be a 24-bed step-down unit, and orthopedics is located here right now. Orthopedics will move to the 4th floor, and then this will be renovated to be the ICU. And then the general acute care are the medical surgical beds on the 3rd floor. So we get 88 private rooms. We have an additional 11 private rooms already, so we have 99 private rooms. The other rooms fall in pediatrics, OB, and in our acute rehab area. So we're going to be pretty much a private room hospital. This just shows you, it doesn't even look like this. This happens so quickly that when you put the PowerPoints together, now it's all glass. All right, but this just gives you, and here you can begin to see the glass. This is at the intersection near the McDonald's there on Hospital Drive. One of the things we are most proud of is, we worked very hard. This is a $72 million project, and our contracts in orange are what was issued within 30 miles of the hospital. It was $29.3 million. Contracts issued within 60 miles, then is another, it's a 42.8, and then contracts overall in Pennsylvania were $52.2 million. So we worked very hard to make sure that the bids went to local companies and companies within our region and within the state. From a timeline perspective, this is just, you have to pay attention to the Gantt chart, but this is, we will move into this building next August. So, it's getting enclosed totally for the winter. They'll finish it up. We will move in August. When we do, the only people that won't move will be the ICU and the step down on the 2nd floor because they function as a team. We have to renovate the orthopedic unit in the existing building. That'll take another 6 to 8 months. So by the spring of 2021, the whole project will be complete. But, we're about 9 months or so out from being into the first major part of this building. And so that's clearly what we're spending our time on, is getting ready to move. Everybody thinks that it is a challenge to get it built. The hardest part is getting moved into it. And we're working on that. This is just an example to show you, many of you notice in Plaza 15 the construction that's going on. What we're doing there is moving our internal medicine practice out of the professional office building. This is Dr. Zella Husky, Dr. Shaw, Keith Johnson, the PA that used to be with Dr. Persing before he retired. They're all moving into this site. And so this will be finished and moved into by the 2nd week of January. So we're not far away from occupying this space. The other thing that I really wanted to talk to you about is somewhat of a different topic. This is to get into our strategy around our employees, okay? And we call this bursting the social bubble, connecting work and life in the employee experience. And we talk a lot about our commitment to exceptional patient experience, but we know in order to achieve that, we have to focus on creating an exceptional employee experience. From the time a candidate says they want to join our organization until they do exist in our organization. And we've seen a significant evolution in the connection of work and life in an employment setting. And that's really kind of what I want to talk to you a little bit about. So it used to be that work and life were separate. And there's people that remember that. I don't know that I haven't had that experience yet. But I think about my father. He used to come home at the end of the day and work was done. And then we had our family life, and the next day he'd go back to work. It was separate. Most of us have experience talking about the work-life balance. How are you balancing it? And what I challenge you now, what you see with the millennials and the Generation Z, is more of this desire and need for a work-life integration. And for somebody like me, and what technology has done to you is that you're never really taking a break from work. It's always there. And at any given time, I can hop on my cell phone and see my emails. People are texting you. You really aren't getting a break. And so it isn't necessarily the best thing, from maybe a health